Most men think erectile problems start in the bedroom. Urologists know the truth. Most men are told the same lie their entire lives, that erections disappear because of age, that time itself steals masculinity, and that once you cross a certain birthday, decline is inevitable. Urologists know this is not true. Age does not end erections. Blood flow does. And the moment you understand that, everything changes. An erection is not desire. It is not testosterone alone. It is not willpower. An erection is a vascular event, as precise and fragile as a heartbeat. When the brain signals arousal, arteries must open, nitric oxide must surge, smooth muscle must relax, and blood must flood into tissue faster than it can escape. If even one step fails, firmness fades. This process does not suddenly stop because you turned 60 or 70. It stops when blood vessels lose their ability to respond. Here is the shocking medical reality. The arteries that supply the penis are among the smallest arteries in the human body. They are narrower than coronary arteries. That means they are the first to suffer damage from aging, inflammation, smoking, diabetes, high blood pressure, and poor diet, long before a man feels chest pain, long before a stroke. Erectile dysfunction is often the first visible warning sign of systemic vascular disease. Large population studies published in journals like the Journal of Sexual Medicine and Circulation show that men with erectile dysfunction have a significantly higher risk of future heart attack and stroke, often 3 to 5 years later. The penis is not failing on its own. It is reporting what the blood vessels already know. Nitric oxide is the molecule at the center of this story. It is the chemical signal that tells blood vessels to relax and widen. In youth, nitric oxide flows freely. With age, oxidative stress destroys it. Chronic inflammation blocks its production. Insulin resistance suppresses it. By age 50, many men produce 40–50% less nitric oxide than they did in their 20s. Not because they are old, but because their vascular system has been under silent attack for decades. Autopsy studies and ultrasound imaging reveal something even more unsettling. Men in their 70s who maintain healthy endothelial function, the lining of the blood vessels, often retain erectile capacity. Meanwhile, men in their 40s with metabolic disease frequently experience severe dysfunction. This is not theory, this is observed anatomy. Urologists see this every day. Two men, same age. One has strong morning erections, the other has none. The difference is not masculinity. It is vessel flexibility. It is blood viscosity. It is nitric oxide bioavailability. It is whether arteries can still expand on command. And here's the fact that changes how you see aging forever. Blood vessels can recover. Endothelial cells regenerate. Nitric oxide pathways can be restored. Studies show that lifestyle interventions improving vascular health, dietary polyphenols, exercise, weight loss, glycemic control can significantly improve erectile function, even in older men. The body does not shut down. It adapts to what you give it. This is why erectile medications work at all. They do not create desire. They do not fix hormones. They enhance blood flow by protecting nitric oxide signaling. Without blood flow, they fail. That is why men with severe vascular disease often see diminishing results over time. The pipeline is damaged. One clinical study revealed that erectile dysfunction severity closely correlates with the degree of arterial plaque buildup, independent of age. Another showed that improving endothelial health improved erections without changing testosterone levels. This terrifies myths and comforts truth. Your body is not betraying you. It is responding to conditions. Blood flow is also why erections are often better in the morning. During sleep, blood pressure stabilizes, cortisol drops, and nitric oxide availability improves. Morning erections are a vascular health check, not a sexual one. When they disappear consistently, it is often an early sign that blood vessels are struggling. This reframes everything. Erectile decline is not a sentence. It is a signal flare. Men are taught to feel shame. Medicine teaches observation. When erections weaken, urologists ask about cholesterol, glucose, blood pressure, waist circumference, sleep apnea, smoking history. Because the penis does not lie. It reflects the state of the arteries with brutal honesty. Even age-related stiffness is misunderstood. Aging does not harden arteries by itself. Inflammation does. Glycation does. Oxidative stress does. Sedentary living does. In populations that maintain low inflammation and active circulation, erectile function persists far longer than expected. Anthropology and epidemiology both confirm this. Here is the most overlooked truth of all. Testosterone does not cause erections. It supports desire and tissue health, but without blood flow, testosterone cannot deliver firmness. That is why men with normal testosterone can still struggle, and why improving vascular health often restores function even when hormones remain unchanged. This is not false hope. It is clinical reality. Erections return when blood vessels remember how to open, when nitric oxide survives long enough to do its job, when inflammation quiets, when circulation improves. Age does not block this. Damage does. That means the question is no longer, how old am I? The real question is, how healthy are my arteries? Because when blood flow returns, confidence returns, intimacy returns, and men realize they were never broken, only unheard. Urologists don't chase youth, they restore function, and function begins with blood, not age. What if the most powerful support for male blood flow was never locked in a pill bottle, never hidden behind a prescription, and never advertised during late-night television, but sitting quietly in your kitchen, misunderstood, underestimated, and stripped of its power by sugar and marketing? Urologists know this substance well, not as folklore, but as biochemistry. Pure cocoa flavanols, not chocolate, not candy, not dessert, have one of the most documented effects on blood vessel function in modern nutritional science. The story begins inside the endothelium, the delicate inner lining of your blood vessels. This single-cell thick layer controls whether arteries tighten or relax, whether blood glides freely or meets resistance. When the endothelium is healthy, it releases nitric oxide. When it is damaged, nitric oxide collapses. And when nitric oxide collapses, erections weaken long before any other symptom appears. Cocoa flavanols directly target this lining. These compounds, especially epicatechin, activate endothelial nitric oxide synthase, the enzyme responsible for producing nitric oxide. This is not speculation. Human trials published in Circulation, the American Journal of Clinical Nutrition, and Hypertension consistently show that flavanol-rich cocoa increases nitric oxide bioavailability within hours of consumption. In one controlled study, participants consuming high flavanol cocoa experienced measurable improvements in flow-mediated dilation, a gold standard test of vascular function, comparable to what is seen after moderate exercise. Blood vessels became more elastic. Resistance dropped, circulation improved. These changes occurred without altering heart rate or blood pressure medications. The vessels themselves responded. This matters because erectile tissue is uniquely sensitive to nitric oxide. The penis contains specialized smooth muscle that depends almost entirely on nitric oxide signaling to relax and trap blood. When that signal weakens, firmness disappears. Cocoa flavanols protect that signal from oxidative destruction. Oxidative stress is the silent enemy here. Free radicals neutralize nitric oxide before it can act. Aging, smoking, poor sleep, and high blood sugar all increase this oxidative load. Cocoa flavanols are potent antioxidants, but more importantly, they prevent nitric oxide from being destroyed, extending its lifespan in the bloodstream. One shocking fact rarely discussed: the average modern diet provides less than 1/3 of the flavanols consumed a century ago. Processing removes them, sugar masks them, heat destroys them. Most chocolate products contain almost none, which means most men have never experienced cocoa's vascular benefits, only its calories. Clinical data reveals something even more compelling. In elderly populations, flavanol intake correlates with better walking speed, lower blood pressure, improved cognition, and stronger peripheral circulation. These are not sexual studies, but they point to the same mechanism. Blood flow is blood flow. What helps the brain and legs also helps erectile tissue. In men with endothelial dysfunction, flavanol supplementation has been shown to improve insulin sensitivity and reduce inflammation markers like C-reactive protein. This matters because insulin resistance directly suppresses nitric oxide production. Fix the pathway, and multiple systems respond. Urologists pay attention to this because erectile dysfunction rarely exists alone. It travels with metabolic syndrome, prediabetes, and vascular aging. Cocoa flavanols don't treat symptoms. They support the root mechanism. Here's where the science gets uncomfortable for marketing. The dose matters, the form matters, sugar cancels the benefit, milk proteins can bind flavanols and reduce absorption. That's why most chocolate treats fail to deliver vascular effects in studies. Pure, unsweetened cocoa powder retains the compounds that matter. In a randomized trial, participants consuming cocoa flavanols daily for several weeks showed sustained improvements in endothelial function, even after stopping temporarily. This suggests structural adaptation, not just a temporary boost. Blood vessels remembered how to relax. This is why urologists don't call cocoa a stimulant. It doesn't force an erection. It restores responsiveness. That distinction is everything. Forced systems burn out, supported systems recover. Another overlooked benefit: cocoa flavanols increase blood flow to the brain's prefrontal cortex. Better circulation improves mood, focus, and stress resilience. Stress hormones like cortisol constrict blood vessels and sabotage erections. Lower stress improves vascular tone. The loop closes. Even more striking, cocoa flavanols enhance mitochondrial efficiency in endothelial cells. That means the cells responsible for vessel health produce energy more efficiently, resist damage longer, and age more slowly. This is anti-aging at the cellular level, not cosmetic, not superficial. This does not mean cocoa is a cure. Severe arterial disease cannot be reversed by food alone, but studies consistently show that flavanols amplify the benefits of exercise, weight loss, and medical treatment. They make the system more responsive. And here is the line that makes urologists lean forward. Erectile function improves in flavanol studies without changing testosterone. Desire stays the same, hormones stay the same, only blood flow changes, and firmness follows. This dismantles a powerful myth. Men chase testosterone while ignoring circulation. Cocoa flavanols remind us that biology is not dramatic. It is logical. Used daily in small amounts, pure cocoa becomes a vascular habit, not a thrill, not a trick, a quiet signal to blood vessels to open, respond, and remember. When blood flows, tissue responds. When nitric oxide survives, function returns. When vessels relax, erections follow. Not because of magic, because of chemistry. This is why urologists pay attention. This is why science keeps repeating the same finding. And this is why something so simple can feel so profound. Sometimes the most powerful support for male vitality isn't new. It's just finally understood. Most men search for a breakthrough, a pill, a procedure, a promise that works instantly. Urologists search for something else entirely. They look for patterns. And over decades of clinical practice, one truth keeps resurfacing. The body responds to what you do daily, not what you try once. Erectile strength, vascular health, and male vitality are not restored by moments. They are rebuilt by habits. This is uncomfortable science because habits are boring. They don't sell urgency. But biology does not respond to excitement. It responds to repetition. Every cell in your blood vessels is listening to your daily behavior. What you eat, how you move, how often inflammation is triggered, whether blood sugar spikes or stays stable. These signals are recorded, remembered, and reflected in circulation. Erections do not fail suddenly. They fade as a long-term consequence of ignored patterns. Here's a shocking fact. Endothelial cells, the cells lining your arteries, turn over every few weeks. That means the blood vessels you have today are not the same ones you had a month ago. They are constantly being rebuilt. The only question is, rebuilt under what conditions? Studies published in The Lancet and Circulation show that daily dietary and lifestyle interventions can measurably improve endothelial function within weeks, even in older adults. This isn't optimism. This is measurable physiology. Blood vessels adapt faster than muscle, faster than nerves, faster than confidence. Yet men are trained to think in emergencies. When erections weaken, panic sets in. When pills stop working, fear follows. But urologists know the problem didn't start that day. It started quietly, years earlier, when small daily choices stacked against circulation. Consider this. Research shows that sedentary behavior reduces nitric oxide production within days, not years. Conversely, light daily activity restores it faster than intense workouts done inconsistently. The body rewards frequency, not extremes. The same is true for nutrition. One healthy meal does nothing. One unhealthy meal does little harm. But repeated daily exposure to high sugar, refined carbohydrates, and inflammatory fats damages blood vessels at the molecular level. Advanced glycation end products stiffen arteries. Oxidative stress destroys nitric oxide. This damage compounds invisibly until erections become the first system to fail. Urologists don't call this bad luck. They call it predictable biology. Daily habits also shape hormone signaling, stress response, and sleep architecture, all of which influence blood flow. Chronic stress elevates cortisol, which constricts blood vessels and suppresses nitric oxide synthase. Poor sleep disrupts testosterone rhythms and increases insulin resistance. These effects don't require disease, they require repetition. Here's the part most men never hear. Medications work best when habits support them. PDE5 inhibitors rely on nitric oxide signaling. If daily behaviors suppress that pathway, the medication struggles. That's why many men experience diminishing returns over time, not because the drug failed, but because the biological environment deteriorated. Clinical studies show that men who combine medication with daily lifestyle improvements often require lower doses and report more consistent results. Habits amplify treatment. They don't compete with it. This is why urologists emphasize small, repeatable actions: daily movement, consistent sleep timing, anti-inflammatory foods, vascular supporting nutrients. Not because they are soft, but because they work. The brain reinforces this too. Consistency reduces anxiety. Predictability lowers sympathetic nervous system overdrive. When stress hormones fall, blood vessels relax. Erections are easier when the nervous system is not in a constant fight or flight state. One of the most overlooked benefits of daily habits is vascular memory. Blood vessels adapt structurally over time. Repeated exposure to nitric oxide improves arterial elasticity. Capillary density increases. Resistance decreases. This is documented in aging populations who maintain consistent lifestyle routines. Their chronological age increases. Their vascular age does not match it. This explains a phenomenon urologists observe but rarely advertise. Some men in their 70s outperform men in their 40s, not because they are younger, but because they are metabolically calmer. Their systems are not inflamed, their blood flows more freely. Daily habits also restore confidence, but not psychologically, biologically. When the body responds reliably, the mind stops anticipating failure. Performance anxiety fades when performance becomes predictable. This loop is broken not by reassurance, but by physiology. And here's the hard truth. Shortcuts create dependency. Habits create resilience. Pills can assist. Procedures can help. But habits decide whether those interventions succeed long term. Science confirms this again and again. Longitudinal studies show that men who adopt consistent vascular supportive behaviors experience slower erectile decline, improved cardiovascular outcomes, and reduced all-cause mortality. These benefits appear even when changes are modest. The body does not require perfection. It requires direction. This reframes the conversation completely. Erectile function is not a switch you flip. It is a signal that emerges when enough systems are aligned often enough. Daily habits don't feel powerful because they don't shock the system. They educate it. They teach blood vessels how to behave again. They remind endothelial cells what flexibility feels like. They retrain nitric oxide pathways dulled by years of neglect. Urologists trust habits because habits respect biology's timeline. Recovery is not instant, but it is reliable. And perhaps the most important truth of all, daily habits return agency. They move men out of fear and into participation. You are no longer waiting to see if something works. You are building conditions that allow it to work. When habits change, blood changes. When blood changes, function follows, not overnight, but inevitably. This is not motivational speech. This is how the human body responds to consistency. Urologists don't promise miracles. They respect patterns. And the strongest pattern of all is this: what you do every day becomes what your body believes is normal. Choose wisely.